Now to your community focus at 4. As cases spike and vaccinations dwindle, what is happening with the coronavirus? The CDC warning there could be a, quote, pandemic of the unvaccinated as the Delta variant continues circulating.
Here to break down the current state of COVID, Dr. Philip Chan of the Rhode Island Department of Health. Doctor, thanks for your time today.
Thank you for having me. Pleasure to be here.
I want to start with a headline that I think kind of stunned all of us in the newsroom last night, that LA is re-implementing mask wearing again indoors for everyone regardless of vaccination status. Is this foreshadowing for what might be ahead of us here in Rhode Island?
Well, I certainly hope not. We are in a good place with vaccinations. We vaccinated, almost 100,000 people are fully vaccinated in the state, so we're in a good place. I am still cautiously optimistic, but this Delta variant is something that we all have to be concerned about, and we all have to use some caution as we move forward here. I am optimistic, though, that we will not be restricting things, certainly like we did during the winter.
That is certainly good news. We're hearing more frequently also of breakthrough cases, people testing positive after being fully vaccinated. Perhaps the most high profile are some of the Yankees team members who tested positive and caused the postponement of yesterday's game. What's your message to people who are fully vaccinated, when they hear stories like this and might get concerned?
Well, we know the vaccine. We've always known that the vaccine isn't quite 100% effective. It's really, really good. During the initial strains, it was 94-95% effective, the Moderna and the Pfizer vaccines. We know that the good news is, though, that these vaccines are incredibly effective against the Delta variant. They aren't quite 100%, though, so people still need some caution. We are going to see and will be seeing some breakthrough cases. We expect that, but the good news is, even when people do have breakthrough cases, is that the vaccines will still protect you from being really sick, from being hospitalized, and from dying. So good news in general, especially in terms of protecting people against the Delta variant.
Dr. Chan, a lot of us right now itching for vacation, looking to travel again after last year. When we hear about places like LA returning to a mask mandate, that vaccination rates are very different all around the country, what would your advice be about travel right now?
Well, we certainly want to encourage people to have fun, especially during the summer. It's obviously been a really long winter. We don't want to tell people not to do things, but I want to urge people to still have some caution. I still think it's prudent to avoid large gatherings. It's prudent to avoid places where people may be sick. If you do find that you're in a situation that makes you feel a little bit uncomfortable, certainly wear a mask, certainly physically distance, or obviously leave the situation as best you can. I think we've learned during the last year and a half here what it takes to protect us from the coronavirus, from COVID-19, and that includes masking and physical distancing and ventilation, washing your hands, not going out if you're sick, and being tested routinely. So all those same things apply, and people just have to do them. And, travel if you'd like to, but just use some due caution, keeping in the back of your mind, of course, that the Delta variant is spreading in many parts of the world, especially, but including here in the U.S.
Our Target 12 colleagues, Eli Sherman and Tim White, reported yesterday that vaccinations are down now to fewer than 700 a day in Rhode Island. Compare that to an average of 8,000 a day back in April. And at this pace, we won't reach 70% of the entire state's population vaccinated until November. Are you comfortable with the pace at which we're currently vaccinating people?
Well, the good news is that we still have several hundred people being vaccinated a day here in the state of Rhode Island. I do want to again make a plea to all Rhode Islanders who are watching this to please consider getting vaccinated. The vaccines are safe. Hundreds of millions of people have been vaccinated. The Moderna, the Pfizer, especially incredibly safe vaccines in general. Just please consider getting vaccinated. It's how we're going to put this all behind us as soon as we can.
And Dr. Chan, we have just about 30 seconds, but I'm curious, while the percentage of vaccinated people testing positive is very low, as we've been reporting, do you think we jumped the gun at all on announcing plans for full in-person school this fall?
Well, I was really nervous back in September of 2020. Again, I have a 10 and a 14-year-old. I sent them back to full in-person learning back in September 2020. I think we have to remember that the most of the K through 12 infections are from people in the community, the vast majority, almost 95+% of them. Of students in the K through 12 setting got it from people in their community, their households, etc. So I'm reassured again that if Rhode Islanders in general get vaccinated, is that that's going to protect our K-12 system. And so that's just another reason to get vaccinated, is that it will protect our K-12 system by decreasing the burden and obviously protecting the kids in the community.
Dr. Philip Chan from the Rhode Island Department of Health, thank you so much for your time today.
Thank you both.